Thyroid gland is situated in the middle of the neck, just on both sides of the trachea, that is the windpipe. Where it enters the larynx, that is the voice box, is very close to the thyroid gland isthmus. In case the nerve is preoperatively involved by the tumor, we can at that time sacrifice the nerve without any complications. Most of the complications which occur after thyroid surgery is because of the parathyroid gland. Hello, I am Dr. Avinash Chaitanya, head and neck surgical oncologist. Today I am going to tell you about complications of thyroid surgery, whether it is for benign or for malignant lesions. We know that thyroid gland is situated in the middle of the neck, just on both sides of the trachea, that is the windpipe. We also know that the recurrent laryngeal nerves, which are required for normal speech, is also present behind the thyroid gland between the trachea and the esophagus. So during surgery, we have to ensure that we are staying away from the recurrent laryngeal nerve, although the place where it enters the larynx, that is the voice box, is very close to the thyroid gland isthmus, where it is adherent very badly. So we have to ensure during surgery that we are taking adequate precautions to safeguard the nerve and keep it aside. Sometimes preoperatively the nerve is involved by the tumor, and that has to be documented by doing a video laryngoscopy or an indirect laryngoscopy and documenting it. In case the nerve is preoperatively involved by the tumor, the same side vocal cord will not move, and that is an indication that it is most likely a malignancy, and we can at that time sacrifice the nerve without any complications. But care has to be taken to preserve the opposite side nerve without any damage. Apart from the nerve, there are two more important structures which we have to take care during the surgery. One is the parathyroid and also the superior laryngeal nerve, which is there in the upper part of the thyroid gland. The superior laryngeal nerve is involved in the pitch of the voice and also the sensation while you swallow. It is usually not injured during the surgery, and it can be preserved more easily as compared to the recurrent laryngeal nerve. But sometimes most of the complications which occur after thyroid surgery is because of the parathyroid gland. We have 4 parathyroid glands in the body, at least 4, and these are situated at the posterior aspect of the thyroid gland, very close to the recurrent laryngeal nerve. So it is important to identify and preserve the parathyroid glands along with its blood supply. It is important to preserve the blood supply also because if you are keeping the gland but the blood supply is not there, they may go into necrosis or at least into a temporary phase in which they don't function. So most of the time, if we are doing a total thyroidectomy, we do give supplementation of calcium, or in fact we have to sometimes even give artificial PTH, so that is a parathyroid hormone which is going to replenish your calcium levels. So most of the time the hypocalcemia, that is the calcium issues because of parathyroid glands, is usually temporary, but sometimes if there is an inadvertent removal of the parathyroid glands, it can result into a prolonged hypocalcemia, which is very debilitating. So care has to be taken during surgery for the same, and this complication is not there when only a hemithyroidectomy is done, because the parathyroid glands on the opposite side are totally safeguarded during surgery and they cannot be damaged just because we are doing surgery on one side. So these are minor but avoidable complications in thyroid surgery. Usually thyroid surgeries can become so uneventful that you can be discharged on the same day or the next day also. So thyroid surgery is safe and effective form of treatment for any thyroid nodules. Thank you.